So welcome everybody, and thank you for being here and dealing with us during this learning curve of the Zoom events platform. It's a little bumpy, but this is kind of where we all were in 2020 when we started using Zoom webinars. So it's all good. We will learn as we go. So I am Melanie. I'm the president and CEO of NB Lung. I'm really excited to be here and sharing in this initiative with the Lung Association of Nova Scotia. Super partnership that we've developed here. Very exciting. Let's see, how do we get on to the next slide? Here we go. Okay, so I'd like to start with acknowledging that the land that I'm joining you from is the traditional unceded territory of the Mi'kmaq, the Wolastoqey and Passamaquoddy peoples. And at NB Lung, we're working really hard in partnership with our Indigenous partners across the province as we work together to really foster our connection with the land that we call home, and knowing that the environment is what supports human health, and how can we work together to bring those two pieces together. At the Lung Association, our vision is all people free of lung disease. And now I'll speak quite specifically to New Brunswick here. 1 in 5 New Brunswickers lives with lung disease, but that actually extends out to Canada as well. So 1 in 5 Canadians live with lung disease. And so it's very likely that someone that you know, live with, or love lives with a lung disease. And so that's really, like Lacey said, at the core of everything that we do. To set the stage a little bit for who I am and what I bring to the Lung Association here, I am a huge vapor intrusion geek. I've been with the Lung Association since 2019. My background is in environmental science, and specifically in contaminated site assessment, and my specialty was in soil vapor intrusion. So I was a subject matter expert in vapor intrusion with the Atlantic Peer Committee, which is partners in risk-based corrective action across Atlantic Canada. And I was the primary author on the vapor intrusion assessment guidance document on how we do in contaminated sites, how we assess vapors intruding into buildings across the Atlantic region. So this picture on the side that I grabbed from some Wikipedia site is a conceptual site model that really formed the basis of my previous life before I came to the Lung Association. And it really depicts all the factors that affect how vapors from the subsurface, deriving either from soil contamination or groundwater contamination, or in the case of radon, from radioactive decay of the underlying bedrock, and how it gets into buildings and all the factors that can affect that. A little bit about radon, like Lacey said, it's a leading cause of lung cancer in non-smokers. In New Brunswick, we have some of the highest levels of radon in Canada. This map is a little bit of a data visualization from our partners at the Research and Productivity Council on the testing that they have done, and red being homes that were tested that were above the Health Canada guidance, or probably above the 800, and the yellow being sort of in that intermediate action level, and green being pretty okay. Well, 1 in 5 houses in New Brunswick has unsafe levels of radon. And when you add that on top of the additive risk of lung cancer for smokers exposed to lung cancer, and we look also at the smoking rate in New Brunswick, we still have about a 10% smoking rate in New Brunswick, again, one of the highest in the country, that risk gets really, really high. These are graphics that I grabbed from Lung Cancer Canada, or sorry, the Canadian Cancer Society. You can see the prevalence of cancer in Atlantic Canada is some of the highest in the country, and lung cancer is even one of the worst offenders when it comes to cancer. So this really drives why we do what we do. There's a very urgent need in New Brunswick and Atlantic Canada, across Canada, for education, awareness, and most importantly, action. And so that's why we're really excited to be part of this partnership and bringing together all the players from across Atlantic Canada, and how can we work together, because Atlantic Canada is so very small. But we've got some really great people, really great expertise across our region, and how can we work together to really address this significant lung cancer risk. So at the Lung Association in New Brunswick, what we've been doing is we've included radon as an important topic in our annual respiratory health symposium. So this is something we do every year, bringing together respirologists, respiratory therapists, thoracic surgeons, and the invite goes out quite wide. We've had about 400 attendees in the last couple of years as we went to virtual. And so we're bringing forward the importance of understanding that radon can be a factor in lung cancer. And providing this education, Lacey alluded to this a little bit before, about the misconceptions that are out there. A lot of people think when we say radon, I think they're thinking about asbestos, and so they think that they have a new home, they're good to go. There's no worries there. So we really need to hammer home that in actuality, there's some evidence to suggest that newly built homes being more tight, having less vapor exchange with the outdoors, that the radon concentrations, if you're in an underlying area with a source of radon, that it's going to be higher in those tighter buildings. It's something we really need to be mindful of as we work towards more energy efficiency as well. On the public side of things, we do outreach through social media. We actually are on TikTok as a platform. We have a high school student who works with us and takes our content and, well, I say she TikTokicizes them. So this content is getting out in front of as wide an audience as we can. And now in New Brunswick, we're really looking to Nova Scotia. We have a lot of inspiration for the programming that is running over there. And over time, I would love to copy every and all programs that they do. But this is just a bit of a taste of what we've been doing in recent years. So we did work last year with Sue Ricards, who I'll call her a radon ambassador. She's a little hesitant to use that terminology, but we really wanted to share Sue's story. So Sue's a non-smoker and ended up with a diagnosis of lung cancer. And she was gracious enough to share her story with us. Last year during Radon Action Month, we really tried to splash that around as much as we could. So we got on, she shared her story on CBC radio. We did some mail outs to New Brunswickers, particularly in the areas of the province where radon is very high. And we had invited Sue to speak with us today at this session, but sadly, she is not doing well. She is undergoing treatment for her lung cancer and is really quite sick. We're really grateful that she did say that we could use her story. And so I would like to share that with you now.
My name is Sue Ricards. I'm pushing 85 years old, and I live in Lower Queensbury. Well, it was a total surprise because I have a history of pneumonia and sort of lung things, but nothing serious. And I had a routine x-ray in 2016. And when I went into the doctor, he was just astounded. I had a tumor just out of the blue because I never smoked. I never lived with a smoker. I didn't work in smoky environments particularly. So we just couldn't figure it out. There's no lung cancer in my family. So we did a little research, of course, and there was radon, second most common cause of lung cancer after smoking. 4 years went by with nothing happening. And then I started getting, my head started to hurt, but it wasn't headaches per se. It was like when you touch your skull, it hurt. So I went back for a CAT scan, and lo and behold, the lung cancer had metastasized to my bones. So that's where I'm at now. I'm being treated and I'm fine. I'm living with cancer. I don't consider myself to be dying from it. And after all, life is 100% mortality rate, right? So sooner or later. However, it's really important to understand about radon because, of course, this kind of cancer is entirely preventable if you catch the radon. No, never was exposed to it. It's not in our family. Last thing I would have ever thought of. That's why I would speak up, because I wouldn't want this to happen to anyone else if they can avoid it. What happened in our case is that when we figured out it was probably radon, we had an expert, a professional, come in and take the readings in our house, and the levels were like off the charts. But we did get a mitigation system. We have a fan and it works great. Our levels are very low now. Well, just how sneaky it is. You have no idea it's there. You can't smell it. You can't see it. There's no indication that it's there at all. And we never would have suspected it. There are ways to deal with it and to mitigate it. And the first thing to do is test. Do it. That's simple. Anything we can do to prevent people from getting sick and ending up in the hospital is worth doing. So there's a personal reason to do it, obviously, but there's also a social reason to do it. And that's a responsibility, like, let's try to reduce the load on the hospitals by preventing as much as we can, and this one is preventable.
So thank you, Sue, and I do hope she gets better over the next little while. Her cancer treatment is really taking a toll on her right now, so we're quite grateful to have spoken with her last year when she was very vibrant and sharing her story, because it's really because of people like Sue that we do what we do, and we want to do everything that we can as a lung association to prevent this type of really debilitating cancer. So with that, I'll leave it there. That's my contact information, and great big thank you from the New Brunswick Lung Association team. And thank you to Lacey for doing all the heavy lifting and putting together this workshop today. We're so happy to be here. Probably we're over time and not the best time for questions. What do you think, guys?
If anyone has a quick question, happy to have it answered right now. If not, we can answer later on in the roundtable discussion. No? Okay. Well, thank you so much, Melanie, for sharing that today, and thank you for sharing Sue's message. It's incredibly important, and you're absolutely right. We do what we do because of people like her. Everyone, thank you so much for joining our second session of the day. We will all reconvene to the lobby, and please join us for our third session of the day with Joseph Edoza. Thank you so much, and see you guys in a minute.